Hello, my name is Kayla Sherman. I'm going to be discussing renal failure. I'm going to be touching on the different types of renal failure. I will talk about patient risk factors, the pathophysiology, clinical representation, cultural considerations, treatments, diagnostic studies, discharge planning, and patient education. Risk factors that are included for renal failure is the elderly, being hospitalized, comorbidities, and blockages in the blood vessels. The main comorbidities that puts patients at risk for renal failure is heart disease, diabetes, hypertension, and any other type of renal conditions. Some of these conditions would include urinary tract obstruction or from infections. There are 5 different stages of renal failure. The first 2 stages can still be reversed, but as the failure progresses, some of the damage cannot be undone. Stage 1 has some kidney damage, but there may be normal or increase in the GFR. Stage 2 has mild reduction in GFR, usually between 60 to 89 milliliters. Stage 3 is categorized with moderate GFR reduction, 30 to 59 milliliters. Stage 4 is a severe reduction in GFR, 15 to 29 milliliters. And lastly, stage 5 is full-fledged renal failure. This is where the GFR is less than 15 milliliters. It doesn't matter the cause of the renal failure, it all follows the same kind of pathophysiology. Once half the total of nephrons are lost, hypoinfiltration occurs in the glomerulus. This then creates an increase in glomerular permeability and activates the renin-angiotensin-aldosterone system, creating hypertension and proteinuria. Angiotensin II and protein uptake occurs at the tubules, causing inflammation and fibrosis. This then declines the GFR, creating a systemic presentation. In the beginning of renal failure, there are maybe any symptoms. Some symptoms generally start to occur in stages 4 and 5. Some side effects are edema, shortness of breath, anemia, weight loss, hyperkalemia, metabolic acidosis, hypertension, nausea, vomiting, loss of consciousness, and coma. Some cultural considerations would be the patient's socioeconomic status. It is important to assess the resources that the patient may or may not have access to. People who live in poor community bases may not have the required water or health care opportunities that others do. It is important to know also their religious backgrounds. Some religions, such as Jehovah's Witnesses or others, may not believe in receiving blood products or even dialysis. Some other considerations to keep in mind is diet, pollutant exposure, crowded living conditions, lack of housing, educational status, and lack of transportation. This could make discharge planning and other necessary things unachievable to the affected patient. The main treatment is to prevent the causes that lead to renal failure. It is important for those who have comorbidities to get them managed. People with diabetes and hypertension need to have strong control over this. This will primarily prevent the renal failure. If the person is already experiencing renal failure, it is important to follow the necessary restrictions. For those with fluid overload, they can be treated with diuretics and limit their fluid intake. Those who have renal failure should also avoid IV contrast, NSAIDs, and other nephrotoxic drugs. These can cause further damage and lead to further failure. It is important to reverse the symptoms as they progress. If a patient has metabolic acidosis, they can be treated with supplemental bicarbonate to slow the progress. Some serious cases need to be treated with dialysis as well as sticking to dietary restrictions. Testing to prove renal failure include blood tests and urine testing. Some blood tests include serum creatinine, glomerular filtration rate, and blood urea nitrogen. Urine testing includes urine analysis and 24-hour urine tests. Further imaging may be needed to see how much damage has already been caused. This would include renal ultrasound and CT scans if the patient can tolerate the contrast. Rarely a renal biopsy may be done. This would be more to identify the amount of damage or identify a certain disease process such as infection. Discharge planning should begin within 24 hours of a patient's hospital stay. The necessary referrals should be made. A referral to a dietitian may be needed to control diabetes or to manage sodium limitations. There'd be more follow-up treatments at an infusion clinic too if they are to receive dialysis. They may also need some transportation or financial assistance. It would be a good idea to get a coordinator in there to get appointments and transportation arrangements made. They also should follow up with a nephrologist as soon as possible. It'd be good to know also community resources such as any support groups or Meals on Wheels or transportation companies such as Compassionate Care so they can get transportation to the necessary appointments. Lastly, it is important to provide patients with the right education. They need to understand the severity of their condition and the importance of following the guidelines. Give them different options when it comes to foods that they need to be followed. For those with limit fluid intake, they can experience some severe dry mouth, which can cause tooth decay. Some ways to help this would be chewing gum, rinsing their mouth with cold mouthwash, sucking on ice or mints, or they can use Biotine to keep their mouth moist. For those who need to limit their sodium intake, they should avoid all processed meats and pickled foods. Choose fresh or frozen vegetables over canned. If they do have canned, they need to rinse it off the excess sodium. And they need to limit their condiments as well, such as ketchup and barbecue sauce, soy sauce, things that people may not think of. It's also important to encourage patients to follow up and keep their appointments. Patients need to be closely monitored for intake output and their weights, so they are not experiencing fluid overload. Thank you for listening to my speech. I hope you found some of this information helpful. If you need anything, feel free to give me contact me, okay? Thank you, and bye.